is Scott, DJ at the A team and that's main cap.
Hi, I'm Sue Brewin. Scott's been with me quite a while now, he's my grandson. Scott has difficulty with the dentist, like lots with autism, right from being a child. He'll sit in the chair, but very often you have to hold his legs down because they'll go up, just with nerves. He don't like anything in his mouth, anything to do with the dentist, especially the drills and the noise. So if Scott has to have anything done, he gets sent to such a place, a small park, to see a specialist dentist. And any major treatment, then Moore Park will refer him to Blackpool Victoria Hospital. When Scott's been in the hospital in the past, we found it very traumatic, mainly because they just don't know how to talk to people like Scott and treat people like Scott. I'm not saying they don't know how to do the job, because I'm sure they're very, very good and they're very professional. It's just you talk to people with autism and special needs in a different way, and more on their level, and we've not found that in the past. But I've got to admit, the dental team, right from, I think her name was Priya, she was absolutely fantastic. She was the nurse that greeted us. It was like an holiday time she'd done, it was lovely. And the anaesthetist and the porter, the doctor, and of course the two lovely dentists, the one from Moore Park and a sister that was there. And it was such a lovely atmosphere. They kept Scott calm, he wasn't nervous. I've never seen him like that before in hospital.
Oh, well, the first time I went in, they greeted me with a smile, and they were saying how are you, and they were saying things throughout. And before I went in, they said what kind of radio you like, and because I'm into music, I said radio wave, of course. So they put that on for me, and I didn't really know what was happening then. And then when I came back out, they were all fantastic. They were saying, "Are you okay?" And again, there was a smile there. The porter was fantastic. I can't say anything bad about him.
He came to talk to Scott and he just said, "Hi Scott," he says, "I'm going to be your porter, I'm going to be taking you down there in a minute. Are you alright?" And asked him his hobbies. Just generally talking to him. And he says, "You'll be fine. Now, will you need a trolley or do you want to walk down?" He says, "If you're going to walk down, I'll be at side of you all the way. I'll be taking you in, you'll be absolutely fine." And I think he just put Scott at ease, because you don't normally get that. From walking into that ward, it was such a different atmosphere with all the staff. It was just unbelievable. And it wasn't just me. There was somebody else facing us. This lady brought a brother in, a lot older than Scott. I don't know, probably late 40s, but he'd got problems as well. And she'd had terrible time at other hospitals, and he'd come from another hospital to Blackpool Victoria. And she said, "Oh, I'm dreading this when the trolley comes, it's going to be awful." But you know, he never ever played up once, while all the time they kept talking to him, he never played up. And when the trolley come, he got out of bed and got on it, and she sat and cried after he'd gone. She said, "I've never ever seen that before in my life."
Great big thank you.
Yeah, I can't thank them enough. And it's not just, you don't normally get a full team that you can thank in one go. But I mean, that day we came home and all we talked about all night was the whole team. It was all of them. It was all of them. And we even had a student nurse come and talk to us that, I think she was under Priya that day. She didn't stay long, she'd got to go somewhere else. But it was just as if it was having the effect on her as well. And she was talking to Scott, and I don't even know if she's seen anybody autistic in the bed before, but she was doing the same thing, which I think is brilliant. Yeah, they're all very, very good. I can't thank them enough. We certainly won't be worried about coming in again. I just hope they're all the same when if ever Scott has to do, go in again. When they're special needs, they've got autism, like in a road accident, if they're in pain, they'll think which is hurting them the most, and they'll centralise that pain onto one spot. So Scott was telling everybody he'd got a really, really bad leg, and they cut his trousers up and looked at his leg. But when it came to, he'd got 2 fractured kneecaps, a fractured leg, a fractured ankle, And one leg hadn't even been looked at for 4 hours. And it's just how you talk to people with special needs more than, you might think they're being difficult, because obviously an adult probably could be difficult. But when you talk to special needs, it's not the fact they're being difficult, it's more the fact they're not really understanding what you're trying to say to them. And if you say it in such a way like what you think they want to know, and say it in that way, they will cooperate a lot more with you.
Thank you for letting us know about the positive feedback for the day surgery unit. I have shared it with our team and also forwarded it to our matron and theatre team. It is good to know that they felt that they were able to meet their individual needs in what can be a very busy and challenging environment. We always try to put the patient first and remember that a place that we all know and are familiar with as our place of work is a very different place for patients. Please pass on my thanks to Scott's grandmother for taking the time to contact us. I know that the team appreciate this very much and are always happy to look at ways that we can improve the way we do things as well.